continuing on with our examples of flexion and extension, if we look at the elbow, so bringing the hand towards the shoulder is considered elbow flexion. Moving the hand away from the shoulder is considered elbow extension. Examples at the wrist, as I mentioned, wrist flexion is often referred to as palmar flexion. Wrist extension, I will say that I have never heard anybody refer to wrist extension as dorsiflexion, but just keep this in mind as a variation. And as I mentioned at the ankle, when we say someone is flexing their ankle, we say that they are plantar flexing. When we say someone is extending their ankle, we say they are dorsiflexing. So that can be a little confusing, but just keep that in mind. Moving on to our abduction and adduction. Typically when I talk about these movements, I will call them abduction and adduction because it is often difficult to decipher if someone is saying abduction or adduction. It can be a little challenging, so you may hear me say it a little bit differently. So when we're talking about abduction is moving away from the midline of the body, whereas adduction is moving towards the midline. You can think of adduction as adding or bringing that part of the body towards the midline. We do have some exceptions at the fingers and the toes. If you take your fingers and you spread them apart, you're abducting them. If you take your fingers and bring them back to the middle, you are adducting them. But one thing I want you to notice is that your third finger, we look at that as our midline. So you can actually adduct your third finger. You're always abducting your third finger. We have the same thing at the foot, except it's with our second toe. So let me give you some examples. When we talk about movement at the shoulder, we talk about abducting at the shoulder, moving away from the midline, whereas shoulder adducting, bringing the arm back to the side, back to midline or anatomical position. Okay. We can have horizontal AB and adduction. So horizontal abduction, you're moving away from the midline, whereas horizontal adduction, you're moving back towards the midline. Okay. When we think about the wrist, we don't usually call it AB and adduction. We call it wrist radial and ulnar deviation. So I think of anything moving towards the radial side is going to be the thumb side. Anything moving towards the pinky side is going to be the ulnar side. So if you can think of P for pinky and U for ulnar, you can think PU and remind you of your pinky side as your ulnar side, if that helps you remember. So a radial deviation or an ulnar deviation of the wrist is actually a form of AB and adduction, right? Moving away and towards the midline. The other thing that we can look at is at the trunk. We talk about lateral bending at the trunk. So you're not actually abducting or adducting towards the midline of your body. You're just moving your trunk in a side bend or lateral position. And you can actually, you could consider moving away from the midline, abducting or laterally bending, and then returning back to midline as being adducting. Moving on to rotation. Rotation is a movement of a bone around its longitudinal axis. So I think of the longitudinal axis as the length of the bone or the long axis of the bone. And we have a couple of examples. We have our internal rotation, which is also known as medial rotation. With our internal rotation, the anterior surface moves inwards or towards the midline. With external rotation or lateral rotation, the anterior surface moves away from the midline or outwards. Okay. I tend to refer to this as internal and external rotation, whereas medial and lateral rotation is not incorrect, it's just another way to say that. We have the same type of movement that occurs at the forearm. We have supination and pronation. And we know that during supination, the anterior surface of the forearm faces forwards or outwards, and during pronation, the anterior surface of the forearm faces posterior or downwards or backwards. So here are some examples. So this is not my favorite shoulder picture, but it is demonstrating internal and external rotation of the glenohumeral joint. So just note that the glenohumeral joint is actually abducted, abducted to 90 degrees. We can also have this where the arm is at the side and the elbow is right here, and we can internally rotate or medially rotate, or we could externally rotate or laterally rotate. So this is not the greatest picture because the patient is not in anatomical position. Looking at the neck, we can have our rotation to the right and to the left. There isn't necessarily a medial or a lateral rotation component to it. And then looking at the forearm, again, we have forearm supination, which is our anatomical position, and then forearm pronation. The last few osteokinematic motions that I want to leave you with are slight variations or deviations from the normal osteokinematic motions that we've talked about. So the first one I want to talk about is circumduction, and here's our picture right here. So I think of circumduction as a circular type of motion, a cone-shaped motion, and it's actually a combination of flexion, abduction, extension, and adduction. So as you circumduct, you're moving your arm in a big circle. So in order to do that, you do a combination of flexion, abduction, extension, and adduction. So all of that occurs together. So circumduction is a unique type of movement. The only joints where this can actually occur are the joints that can do flexion, abduction, extension, adduction, internal and external rotation. So you have to, you can only circumduct at parts of the body that have the most amount of motion. We call this 3 degrees of freedom. So most likely you're going to see circumduction at the shoulder, the glenohumeral joint, and then the hip joint. Those are both our ball and socket joints. Another type of motion is our inversion and eversion, and this is specifically at the ankle, as you can see here. And this is, I think of the position of the bottom of the foot, lets me know what whether I'm inverted or everted. So if we look at the bottom of the foot, and the bottom of the foot is inward, this is inversion, so towards the midline of the body. So I know we only have a foot and an ankle here, but if this is the midline of the person's body, this is medial, this is lateral, the bottom of the foot is moving inward, that is inverting. If the bottom of the foot is moving outward, we are everting. Okay, so it is all relative to the bottom or the sole of the foot, relative to the midline of the individual. The last movement that I want to mention is protraction and retraction. And I think of this as a linear movement that occurs parallel to the ground. And what we're talking about in this particular picture is the scapula. So we're saying as we are protracting the scapulas, we are moving them anteriorly. As we are retracting the scapulas, we are moving the scapulas posteriorly. This example, like I said, is just of the scapula. You can protract and retract other parts of the body. You can protract and retract the head itself. You can protract and retract the jaw or the mandible. But most of the time when we're talking about protraction and retraction, we're talking about the movement of the scapula. So again, the scapula moving forward or anteriorly is protraction. The scapula moving posteriorly is going to be retraction.